starting with another important feature, which is actually consistency. So basically the gingiva is firm and resilient, means it is actually due to its firmness and resilient feature. It resists many things actually. An exception with that, it has also free margins, and it is also tightly bounded to the underlying connective tissue. It has collagenous nature of due to the lamina propria, which is connective tissue, and continue with the mucoperiosteum of the alveolar mucosa, means it is actually continue with the alveolar mucosa, which actually determine the firmness of attached gingiva, means that attached gingiva is firm due to its actually attachment with the alveolar bone. Gingival fibers also contribute to its firmness of the gingival margins, means if the gingival margins are firm, it is basically the gingival fibers which is present in it. Now very important, texture. Surface texture is basically similar that of an orange peel, referred as staple. Staple is very important feature for the healthy gingiva. Stapling is basically viewed during the dry gingiva very well, and the attached gingiva is stapled and the marginal gingiva is not, but the central portion of the interdental papilla is stapled, but the marginal borders are smooth. Okay, the pattern and extent of stapling, it is actually different among different people, and of the same and among different areas of the same mouth, means it is different in different areas of the same mouth. Stapling is less prominent on lingual means it is not present on the lingual surfaces and absent even in some people. Stapling is actually, it changes with the age. It is absent during the infancy or neonates, and it appears after the 5 years of age. It increases with adulthood and basically disappear during the old age. Okay, they are saying, and then they are saying that the stapling is produced due to the alternate rounded protuberance. It is actually the protuberance and depressions in the gingival surface. Okay, then the papillary layer, which is actually present in the connective tissue, is projects into the elevations, and elevated and depressed areas are covered by stratified squamous at the epithelium. The degree of keratinization and the prominence of stapling appear to be correlated, means it depends. Also you can say that the degree of keratinization and stapling is actually related. So stapling is actually what this is. These are the depressions in the gingival surface and protuberance. It is absent in the neonates, but it appears after 5 years. It disappears during the old age actually, and it is present. It is a sign of healthy gingiva. Through the microscope, basically the depth of the stippling is actually changed. Okay, when you see through the low magnification, so the rapid surface is seen and interrupted by the irregular depressions, which is actually 5 micrometer in diameter. In higher magnification, cell micropits can also be seen. Okay, stippling is actually basically a specialized functional adaptation, which is a feature of the healthy gingiva, and basically when there's a reduction in the stippling, it is a sign of the gingival disease. Okay, but it is actually restored after the health when it is treated. So basically stapling appearance also returns. Okay, the surface texture of the gingiva is related to the basically the presence and degree of epithelial keratinization. Keratinization is basically a protective adaptation to function. Okay, this is present in those areas of the gingiva which is actually basically can be damaged. So that those areas are very keratinized, and those they are basically which is also which can also be seen in the oral cavity. Those areas that are exposed in the oral cavity, they are basically keratinized. Okay, now it increases with the tooth brushing. The keratinization also increases due to brushing. Okay, because it irritates the gingiva. Okay, then basically the free gingival grafts you have also seen when connective tissue is transplanted from a keratinized area to a non-keratinized area, means when a connective tissue is taken from keratinized area to non-keratinized area, so that area become eventually keratinized. Okay, now the finding suggests it is a connective tissue based genetic determination of the type of epithelium surface. Okay, the position of the gingiva is basically present at which the gingival margins it is attached to the tooth. Okay, now when the tooth erupts into the oral cavity, so the margin and the sulcus are at the tip of the crown, means they are present on the tip of the crown, but during eruption it becomes close to the root. During this eruption process, basically the gingival epithelium during this eruption process, as described previously, which I have also told you, so the gingival epithelium is converted, which is first of all was oral epithelium. Okay, now and the reduced enamel epithelium undergo extensive alterations and remodeling and maintaining the shallow physiologic depth of sulcus. Without this remodeling, the epithelium in an abnormal anatomic relation between the gingiva and tooth would result. Means if this remodeling was not happen of the gingiva, so there will be an abnormal anatomy between the gingiva and the tooth would result. Okay.